Want to learn exactly what your risk of developing cancer is if you carry the breast cancer gene or another cancer-causing gene? We will teach you all about it. I'm here with Dr. Kevin Hughes of Harvard's Breast Cancer Center and the world's leading advocate for genetic testing for cancer-causing genes, specifically the breast cancer gene, and there's much, much more beyond that. Thank you for visiting with me today.
John, thanks for having me.
I want to talk about a breakthrough website where we can now help you as a patient or as a physician in your office. If you carry a cancer-causing gene, let's say you carry the breast cancer gene, the BRCA mutation, or any other cancer-causing genetic problem, or one that we're not sure what happens, we can run that information through a calculator called the ask2me.org. It's available to everyone, ASK2, the number 2, me.org. And you can find out specifically for you, based on your age, and also some medical history, what your risk is for the different kinds of cancers that are associated with the different gene mutations, such as the breast cancer gene, the BRCA, the CHEK2, and the list goes on. Tell us about the Ask2Me calculator.
Sure. So basically, genetic testing has now become very routine. It's relatively inexpensive. We're testing for a large number of genes. We're used to test for just 1 or 2. It's very hard for physicians or patients to know what each of these genes means. What we've done is we've reviewed the literature, and our team has put together the best in literature for each of the gene cancer combinations. We tried to put that into a calculator that would help people know what their risk is. And so if you have a mutation in BRCA1 or a mutation in CDH1 or PALB2, which all sounds like Greek, if you go into the website and say, this is a mutation I have, it's a cancer-causing mutation, this is my age, this is my gender, it will then tell you your risk of cancer going forward. And it tells you for each of the cancers you're at risk for, how much that risk is, and then some of the management guidelines available for that.
It puts all this information together that even I, as a breast cancer surgeon and a big advocate for genetic testing, is too much for me to withhold in my brain. And I had a patient that came to see me with a gene that causes breast cancer and other cancers, and it wasn't the breast cancer gene. And she was convinced she wanted a mastectomy. And after running it through that calculator, and I wasn't sure what I was going to come up with, it was amazing to be reassured that her risk for developing breast cancer was actually pretty low versus crazy high. And she and I were comfortable going forward. Didn't need a surgery, didn't need to go through that process, and we can follow her. And my goodness, when you know for you what your risk is, it's reassuring.
I think that's very true, and I think the idea is that we want to give the patient an individual risk, not a general risk. And a woman who's 25 who has a BRCA1 mutation is at a very high risk of cancer in her lifetime.
Because she can live, she's got 70 years to live.
Exactly. But if you have a 70-year-old woman with that same mutation, her risk is not that high. That's a difference in age. And then there are different mutations. BRCA1 has a high breast cancer risk. ATM, another gene, the risk isn't so high. So we don't want to think that all mutations are the same, that they all cause the same cancers, that they all cause the same level of risk. We need to individualize it for that patient with that mutation at that age.
Ask2me.org. It's associated with Harvard and MIT's labs, correct? You guys put all that information together.
And with Dana-Farber as well, in Boston.
And it's available to everyone. And that's what we're trying to do at the Breast Cancer School for Patients. Translate this information so everyone, you're making it available to everyone. You've been preaching to physicians in the community for 2 decades. And now we're getting to the point where people can find this information.
Yes.
People used to come up from all over the country to find you in Boston, probably, for genetic testing. Now they can get it everywhere.
Correct.
But it's still a lot of work, and you have to research this information, especially if you think that you're at risk for a breast cancer causing gene and then undergo genetic testing. What we're really talking about is if you're identified as having a cancer causing gene, say one of the 30 main ones, or a variant, and if you've heard the term variant of uncertain significance, VUS, the term we use in medicine, we can take that little small change on that gene that we don't think causes cancer, and then even with your website, we can research the information we have with data everywhere to kind of get a sense if that small little variant is at risk to you.
That's exactly right. And we think of genetics as being a precise science. It is not. There are many mutations that are in genes that we see that we don't know what they mean, or that are irrelevant. Like a blue eye versus a brown eye person, they have different genes, but they're both perfectly normal. With a VUS, we don't know if it's cancer causing or not, but that information becomes available over time as we learn more about that gene. What we try to do is make a space within Ask to Me where you can put in your variant. We can tell you what people think it means, and also track that in the future and let you know if that thinking changes as people gain more information.
So many breast cancer specialists, even people that test for genetic testing, this is new to them. This has been available for about a year, but you're out preaching for people to use this tool. Just like the patient I was just saying that it really helped me, most importantly, helped her make good choices. But it's available to you. So if you want to learn more about breast cancer gene testing, go to the Breast Cancer School for Patients and you can search BRCA testing. We have a whole video from the Breast Cancer School for Patients, more oriented towards if you're diagnosed with breast cancer, but it has all the information you need to know to get started. And we have the link for Ask to Me on that webpage. Thank you for visiting with us and watching us, and Dr. Hughes, thanks for sharing your time with us. You're doing a great job and helping so many people that you don't know, and helping so many people in the future because of all of your work.
John, thank you, and thank you for all your hard work making sure this is out there and people know about it, not just this, but all breast cancer.
We're going to keep pushing it, both of us.
Sounds good.
Thank you.
Thank you.
To learn more about breast cancer, visit the Breast Cancer School for Patients, where we actually teach you everything you need to know. We're here to help you get the best possible breast cancer care in your community. Register on our website to get our list of questions to prepare you for your next doctor visit.